Hello, everyone. I'm Garrett Thomas, and today I have the pleasure of speaking with Dr. Alicia Trbovich, who is a licensed neuropsychologist. Dr. Trbovich is affiliated with the UPMC Sports Medicine Concussion Program, and she is an assistant professor at the University of Pittsburgh in the Department of Orthopedic Surgery. Dr. Trbovich will be speaking at the upcoming SNS Symposium, giving a talk titled Domain Targeted Treatment and Rehabilitation Following Sports-Related Concussion. Dr. Trbovich, thanks for being willing to speak with me today.
Absolutely. Thanks for inviting me.
Yeah, absolutely. So to get started, can you tell me a little bit more about your upcoming talk and give a quick description of what you plan to present?
Yeah. So, as far as domains, we're talking about the domains of function that are affected following a concussion, which I probably won't be reviewing in detail. It'll be coming before my part of the talk, but then I'll be talking specific regarding, okay, if you find this deficit, this impairment, this pattern of symptoms, then what should be your treatment approach specifically? Because we learn more and more about how diverse concussions are, and not everybody presents the same or has similar findings on their evaluations. So this is really going to be getting to the nitty gritty of, okay, you see X, you recommend Y.
Yeah. Yeah, it's sort of that more precision medicine approach in a way, or sort of really individualizing or tailoring treatment. And I'm curious to hear a little bit more about your opinions or thinking about this domain-specific treatment versus
Mhm.
recommendations more generally. How do you see this
Right.
benefiting recovery from concussion and treatment?
Yeah. I mean, while there's some recommendations that are, I would say, are pretty universal or kind of blanket statements about approaches to take with concussion, sometimes you can really miss the boat if you're not targeted with a specific treatment. Like if there's a notable vestibular issue, for example, and you're just vaguely telling somebody, oh, get more active or do a little bit more. That might not actually translate to them targeting the right activities, and then maybe not getting the specific actual formal therapy with a one-on-one with like a physical therapist that could actually facilitate the process of recovering from a vestibular issue. That's just one example of probably one of the domains I'll talk about.
Yeah. Well, again, I think that it's super important. The education piece is really important, but then certainly tailoring treatment, like you mentioned, you're thinking about in your experiences, how has this changed the way that you've managed concussion, your group has managed concussions, and sort of what are the benefits that you've seen?
Yeah, absolutely. I think we are definitely cutting down on recovery time. Um, it's you can see how like sometimes you can give these blanket recommendations, and if the injury is perhaps routine enough or mild enough, and you have like a savvy athletic trainer who knows how to work with a concussion patient, you might get the results. But I've definitely seen people that have come to me weeks, months, maybe even years post injury, and they have lingering deficits because they haven't received a specific treatment, and then their behaviors along with that have been basically contraindicated. Like they have, again, I'll just stick with my current example of a vestibular issue. They're completely avoidant of movement. They've changed the way they approach going into situations. They've isolated from certain situations because they're provoked or triggered. So then it changes the way they interact with their whole environment. And then you get all these secondary problems. So sometimes you can get vestibular recovery without anything fancy, anything special, but you don't want to bank on that, especially for complicated cases or more severe injuries. I see people who come who could still use therapy, even though it's way outside the time period that you would anticipate a typical concussion recovery.
Yeah. I think that's really important too, and important to keep in mind, right, for patients thinking about, this is something that can be used at any stage of the concussion recovery, not sort of that immediate acute phase, but sort of, anywhere along that process. It sounds like that, this could be helpful for anyone, who's still dealing with symptoms of concussion. Is that fair to say?
Yeah, yeah, and I think that I'll try to break that down in my talk as far as, we have research. We don't have a ton of research yet, but if we focus on what has been done at what stages of recovery and what the outcomes have been. But some of it's going to be, just talking about where the future needs to go with further research, because I know we don't have a million trials on, for example, vestibular therapy showing 1 week, 2 weeks, 2 months, a year, when it's most efficacious. Um, but yeah, in general, I think that's my clinical anecdote there is, yeah, I've seen it be useful 2 weeks post injury or 2 years post injury for certain people.
That's great. Yeah, I'm really excited to hear more about this talk. So, our last question here, what are you hoping that other neuropsychologists, other providers will be able to get from this talk?
Yeah, I'm hoping that they'll be able to identify people in their own area by the education I can provide, figure out their resources to get their patients the help, because not all therapy is created equal. You can send to a general physical therapist to get something different than a neurophysical therapist, for example, that's trained with concussion. And trying to have everybody get a better idea of what kind of providers and specialties do you need on board for certain problems, so they can actually apply it to their real practices, which might be a whole lot or a little bit depending on what area of the country you live in and what the resources are, but at least knowing what they're looking for, and kind of what lane to drive down once they've gotten the accurate, they've accurately assessed comprehensively and like, okay, I think this patient needs X. Now how can I find Y? So in a nutshell, that's what I'd say.
Yeah, even shedding light and making people aware that this is an option, or even a viable treatment.
Exactly. You don't have to wait and see for a whole month before you pull a trigger on a therapy, or you don't have to just hope it goes away, something, there is more and more as time goes on, more options, and we're learning a lot more how to refine those options. And then, the time for implementation is the time it'll take for implementation, and then things will change. That's fortunately the world we live in.
Well, Dr. Turbich, this has been fantastic. Thank you again for taking the time to speak with me, and I'll be looking forward to hearing more about your work and sort of taking more of an active role in recovery from concussion, or helping people to take a more active role. Yeah, looking forward to seeing your talk in SNS in Philadelphia this May. For those of you listening, you can read more about the conference and register to attend the SNS Symposium on the website at sportsneuropsychologysociety.com. You can also follow SNS on Facebook and Twitter. Dr. Turbovich, thanks
Awesome.
again.
Thanks again for having me.
Absolutely.